For this lecture, you should be able to list the steps involved in the pharmacist-patient care process, explain a pharmacy technician's role in the pharmacist-patient care process, differentiate between the role of a pharmacist and that of a pharmacy technician as it relates to the pharmacist-patient care process. So we're going to start with the basics. This comes from the Joint Commission of Pharmacy Practitioners. This is their framework for the pharmacist-patient care process. As you can see, patient-centered care is at the middle with collaborate, communicate, and document surrounding it. Around that, we have a process of collect, assess, plan, implement, and then finally follow up, monitor, and evaluate, and then it continues. So we're going to dive into each one of these individually. So starting with collect, this step involves the collection of all relevant information about the patient. It may include the patient's current medications, their disease states, their lifestyle habits, or even their preferences and beliefs. Next, we have assess. This step involves the pharmacist assessing the information that was collected, as well as what was absent that the patient may need. Moving on to plan, this step includes creating a plan of how to move forward with the patient. This step may involve considering things like the goals of therapy or how to find a cost-effective medicine for the patient. Then we have implement. So this step involves starting the plan that was previously discussed. So this may include providing education, giving vaccines, or scheduling follow-up care for the patient. Finally, we have follow-up, which is monitoring and evaluation. This step involves reviewing the effectiveness of the plan. This may involve reevaluating the patient's labs or simply checking in to see how they're doing. So now that we have the basics down, we're going to see what the pharmacy technician's role in all of this is. So pharmacy technicians do play an essential role in each step of the pharmacist-patient care process. Without pharmacy technicians, important details about the patient would be missed. This could include allergies, current medications, and even just the patient's general appearance. So even just being able to know whether or not a patient looks sick or whether they look well can really be a vital part of this process. So starting with collect, pharmacy technicians can be an essential part of this step. Y'all are able to collect a complete medication, medical, and lifestyle list for the pharmacist. So the pharmacy technician is typically the first person that the patient speaks with. It's up to you to collect the accurate demographics and insurance information to help the patient. So when the patient approaches you at the counter, you're the first person that gets any chance of collecting these big items that may help save the patient in the long run. So figuring out whether or not the patient has allergies, figuring out what other medications the patient may be taking, figuring out whether or not the patient smokes or if the patient drinks are all key pieces of information that can be collected at this point to help the pharmacist in this process. So now we're going to talk about something called a medication reconciliation. This may be the most influential role that you guys can have in preventing dangerous drug events. So according to the Institute for Healthcare Improvement, medication reconciliation is the process of creating the most accurate list possible of all medications a patient is currently taking, including drug name, dosage, frequency, and route, and comparing that list against the physician's admission, transfer, and/or discharge orders with the goal of providing correct medications to the patient at all transition points. So this is essentially talking to the patient and asking them what medications they take every day. And once you have that list of medications, you go to whatever list the doctor provides you with, and you compare the two to see if the patient's on anything they shouldn't be, or if they aren't taking something they should be. So this is all stuff that the pharmacist will take care of, but you could do the collect portion of this by getting the patient's medication list for the pharmacist to make that comparison. Next, we're going to talk about assess. So pharmacy technicians can help in the assess portion by assessing the patient's overall appearance, cultural factors, health literacy, immunization status, as well as catching drug errors. So by knowing the common medications in their classes, you can assist your pharmacist in catching medication errors, such as duplicate or inappropriate therapies. So if you know your medication classes very well, and you notice that a patient's getting lisinopril filled and also getting enalapril filled, you'll be able to know that those two medications are in the same class, and more commonly than not, the patient doesn't need both of them, so the pharmacist can make an intervention and actually help the patient. Another thing is just knowing whether or not patients have had their immunizations. So as a pharmacy technician, you'll be able to look through and see whether or not they've had a flu vaccine this year. From there, you'll make an assessment and then tell your pharmacist, hey, I think this person could use a flu vaccine. And then from there, the pharmacist may be able to administer a vaccine to the patient. So another piece of this is medication therapy management. Medication therapy management, or MTM, is what it's commonly called, is a service used by pharmacists to optimize patients' therapeutic outcomes. So this involves calling patients to check in on their medications, how they're doing, and any changes that may need to be made. Pharmacy technicians can play a part in this role by identifying good candidates for MTM, such as patients who are on numerous medications or patients who may be late for getting their medications refilled. So as a pharmacy technician, a lot of times you guys will screen the calls for patients who need refills. The patients will call in and you'll take the refill request, so you'll have a good idea of whether or not patients are filling their prescriptions every 30 days or if they're running about a week late every month or anything like that. So you're a great tool for the pharmacist to let them know, hey, I think Mr. Johnson's running a little late on his refills each month, so I'm not sure if he's taking his prescription as he should be. Maybe we should enroll him in MTM. Next, we have the plan portion. So one of the best ways that a pharmacy technician can help pharmacists in this process is by finding the most cost-effective option for a patient. So as your pharmacist is developing the plan for the patient, you could check the availability of different medications as well as how much they would cost for the patient. So as the pharmacist is working with the doctor to find alternatives for patients or even just find the right medication for a patient, you can work with the pharmacist to thus find out how much is that medication going to cost the patient, as well as how is that medication going to cost for your pharmacy, because that's always a big piece as well. Then we have the implement. So you guys can help during this aspect by ensuring that patients have the opportunity to talk to the pharmacist whenever they make a change. By offering the opportunity for patients to be counseled by the pharmacist, you may be preventing future medication errors and can help them on a path to better health. So this is really making sure that anytime a patient picks up a new prescription or a prescription that it seems like they may not be too sure about, you give them the opportunity to speak with the pharmacist by just asking, what questions do you have for the pharmacist today? Or would you like to speak with our pharmacist today? Because then the patient will have their questions answered, and ultimately it'll prevent the error that may have happened if they went home and then did not have the answer to their question. So a good example of this is what happens with children's antibiotics. They have to be drawn up into oral syringes or poured into measuring spoons a lot of times, but sometimes people don't know how to work these syringes and the antibiotic ends up being misdosed. In this event, it typically isn't too dangerous. However, it could be if the patient were allergic to the antibiotic, or it could cause them to get really sick. So this is one of those situations that if you were able to talk to the patient beforehand and give them the option to just say, hey, do you have any questions for the pharmacist today? They may have been able to learn how to use the syringe and the error could have been avoided. Pharmacy technicians can also play a role in wellness promotion in the implement portion of this process. So this may involve offering to have the pharmacist administer a flu vaccine in populations that need it, or offering smoking cessation pamphlets to patients that are smokers. So if you notice that a patient's coming in and buying nicotine patches or nicotine gum, you can always have brochures or smoking cessation pamphlets, like it said, to the side and offer these to those patients. Quality assurance also comes up in the implement portion. So quality assurance helps to reduce the amount of medication errors that are made by standardizing different processes to safely implement the patient care process. So this is basically saying that there is standardization that happens in order for us to implement any changes that we may implement. So there may be a standard process for how a patient receives a flu vaccine in your pharmacy. That would be quality assurance. So examples of quality assurance include computer software that requires a pharmacy technician to confirm a drug that is entered if there is a lookalike medication that looks similar, or the computer requiring that the pharmacy technician scan their badge to ensure that they have selected the correct patient in order to fill a prescription. Another example of quality assurance is the use of automated machines to fill prescriptions to prevent medication filling errors such as the wrong drug or the wrong quantity. Quality assurance is typically built into each pharmacy's policies and procedures and may also include the standardization of workflows, education and training, and the calibration of instruments. Emergency preparedness also falls within implements, so sometimes part of the implementation of patient care must happen in an emergency situation, such as a mass casualty or a pandemic. Pharmacy technicians can help in implementing emergency preparedness by compounding medication stockpiles, delivering the medication to the appropriate places, and helping to triage patients, just to name a few tasks. Finally, we have follow-up, monitor, and evaluate. By training in tasks such as taking blood pressure, blood glucose, and point-of-care cholesterol, you can assist the pharmacist in evaluating how patients are doing on their medications. Another opportunity for pharmacy technicians is just talking to the patient to hear how they're doing. If a patient states that they're experiencing side effects of a medication or symptoms of a worsening condition, you can refer them to the pharmacist to prevent an adverse drug event. So basically, this step is just seeing how the patient's doing, evaluating how effective what we're trying to do is working. So as a pharmacy technician, you can let your pharmacist know, hey, Mr. Johnson doesn't look so good. That's a part of this step. Or even just saying, would you like me to take your blood glucose? And getting trained to do that will allow us to know if a patient's insulin is working for them. So this is where you could really have a key part or a key role in this step. So with that being said, we wanted to discuss some emergent patient scenarios because you can monitor patients for these. As a pharmacy technician, you can help the pharmacist in this step by monitoring for emergent patient scenarios and alerting the pharmacist right away. So first, anaphylaxis. This is a severe allergic reaction that typically results in the swelling and ultimate closure of the throat. Patients should be monitored after given vaccines for signs of anaphylaxis. Then we have heart attacks. This is typically a result of a blockage to the heart. Patients will typically present with severe, heavy chest pain that sometimes radiates down the left arm. So if you see either of these situations, it's important to go ahead and grab your pharmacist immediately. So now another emergent patient scenario. We're going to talk about strokes. So this could be a result of a blockage of blood to the brain, which is an ischemic stroke, or an active bleed within the brain, which would be hemorrhagic. Patients experiencing an ischemic stroke may have facial or arm drooping or slurred speech. Patients experiencing a hemorrhagic stroke will often complain of a thunderclap headache or the worst headache they have ever had that suddenly appeared. So remember to act fast. This is the acronym we use for strokes. So F is for face drooping, A is for arm weakness, S is for speech difficulty, and T is for time is brain, meaning that as soon as you notice these symptoms, it's important to go ahead and get the patient help. Also, a part of monitoring and evaluating is adverse events. So we're going to talk about MedWatch. That's the FDA's program designed for reporting adverse events associated with medications, medical devices, foods, beverages, cosmetic products, supplements, and more. As a pharmacy technician, you can assist your pharmacist in the monitoring of patients by submitting any adverse effects that patients experience from the above items. Next, we're going to discuss near-miss events. So these are events that could have ended in serious harm but were caught beforehand. Examples of common near-miss events in pharmacies include dispensing the wrong medication, the wrong dose, choosing the wrong patient profile, and not documenting allergies. Detection of near-miss events are important when following up with the patient so that a plan can be made to avoid the event next time. A lot of times when a near-miss event happens or an error in the pharmacy happens in general, you'll complete a root cause analysis. So a root cause analysis is a systemic way of reviewing errors to find the root cause of the problem and then appropriately responding to ensure that the error never happens again. So a common technique used is called the Swiss cheese model. This model examines the organizational breakdown that caused an error on each level. As a pharmacy technician, working with your pharmacist to perform root cause analyses on errors around the pharmacy can ensure that patients remain safe. So I have a graphic here demonstrating the Swiss cheese model. You'll see at the left you have the source of harm, and what happens is you'll move through these different Swiss cheese holes until you get to the undesirable consequence. So on the left, the source of harm may be that your pharmacy dispensed the wrong medication to a patient, and all of these barriers or controls would be opportunities that it could have been changed. So this white Swiss cheese would be you as a pharmacy technician where you chose the wrong medication. And then the purple Swiss cheese would be the pharmacist who verified the order but did not change the medication. And then the green Swiss cheese would be the person who dispensed the medication and actually sold it when the patient picked the medication up, but didn't realize that it was the wrong medication. And finally, that last light green Swiss cheese would be the patient who didn't realize that they received the wrong medication, and they ultimately took it, meaning it slipped through all of our hands, and they had the undesirable consequence. So now we're going to dive into the pharmacist versus the pharmacy technician's role. So it's important that we revisit tasks that pharmacy technicians can complete compared to a pharmacist as it relates to the pharmacist patient care process. Remember that pharmacists are the only ones that may make recommendations, discuss medication side effects or changes, or counsel patients. So as a pharmacy technician, it is always best to check with your pharmacist to see how you can best help them along with this process. When in doubt, it's always best to be safe. It's always best to ensure that you're not breaking your pharmacy's standard operating procedures. So definitely just check with whoever your pharmacist is and say, hey, how can I best help you along with this? So in summary, the pharmacist patient care process is a standardized approach to patient care that involves collecting patient information, assessing the patient's status, planning any changes, implementing that plan, and following up with the patient before starting the process all over again. Pharmacy technicians play a key role in each step of this process, assisting the pharmacist with providing the best patient care possible. With that being said, I hope you guys enjoyed this lecture. This is one of my favorite portions of being in pharmacy. It's where you really get to see a patient change. It's where you get to take care of people. So I hope that you enjoy your time in pharmacy practicing this. And if you have any questions, please reach out to us.